Hold on, boys, I'm just going to sort this out. We pull up, and before we've even left the van, I spot two of our teenagers having a Barney. They're up, and they're boxing. It's that time of year. These two roos are best mates, normally. I just keep an eye on it. The grunting's getting louder, then there's a big right hook. If I see some fur start to fly, or it seems to get out of control, I've got to stop them. Hey, boys. Hey. Leave him alone. Leave him alone. Sit down. Sit down. There you go. There you go. Good boy. Is it dangerous? A little bit. But the reality is they don't associate me with something they want to fight. So if I just walk in slowly and make my presence felt, they should stop. Leave him alone. Go on. That's a boy, yeah, you won. Off you go, mate. See ya. Right, let's go.
Trouble averted. Now Tim can turn his attention back to Daenerys.
Probably the best thing to do would just be let her walk straight out.
She'll come straight away?
She'll come out. And if we need to, I'll pick her up.
We have a plan. Daenerys goes for a walk every day, and her main relationship is with Dan. He's known her since she was very small. Dan opens the door. Hello. Daenerys comes strolling out and she goes for a walk through the park. We're going to do most of that, but we're going to turn right and jump in a van. Look at that, what a lizard. As friendly and accustomed to this as Daenerys is, she's still a Komodo dragon. Inside that mouth are razor-sharp teeth, and they're venomous. So they bite a water buffalo on the leg. The venom goes in, the bacteria causes an infection, that's how the prey dies. It's no different if they bite us. If Daenerys grabs on, and she means it, she won't let go.
In Bondi, Kate is making a very special house call for a patient in desperate need of some extra TLC.
Brucey, come on.
Come on, in you come. Hey, how you going?
Bruce is a 3-year-old rescue dog, and his worried owners, Martin and Anna, have called Kate because they're extremely worried about their special new boy.
So Brucey's been struggling a little bit with some anxiety.
Yeah, what we really notice it is that, like obviously right now, but when we're leaving the house,
Yes.
putting your shoes on, put a hat on or something like that to go
Yes.
for a run, you can see his mood changes.
Yes.
So he really starts to get anxious. You can see it build. And then once the door's closed, there's just this noise that just comes out of it. We love him dearly.
Yeah, he's like a little baby.
Yeah.
Bruce's anxiety probably comes from a few places. You know, it wasn't till 6 months till these guys adopted him from the shelter. We don't know what kind of a background that Bruce had. When I first saw him, he was really thin. He was really neglected. And I think that that has a large part in this particular case, in that he would be so worried about these guys leaving him.
We were struggling and getting anxious ourselves to leave the house, so we had to tiptoe around. It got to a point where, you know, it was really challenging for the both of us.
And Marty, you said that I could probably hear this from the vet clinic.
Yeah.
So it's got to be pretty loud.
Yeah, I've gone for runs and
Yeah.
I will run about 1 kilometre away and I can still hear that noise going on.
Wow, 1 kilometre.
Yeah.
It's really painful.
So-
As soon as we leave the house, your heart just breaks hearing him. And
So you guys are basically trapped in your house.
It feels a little bit like that at the moment, yeah.
He would be walking around all the time thinking, oh my gosh, I'm going to get left. That constant worry and that constant anxiety, he can't live like that. So what I'm going to do is put cameras inside and out near the gate, and then we're going to exit and we're going to see what happens when we go, okay?
Yeah.
So let's put some cameras up.
Sounds good. Let's go.
Hey, we got here.
Simba. Simba's swallowed some Tiffany jewellery, so Mummy's not happy with him.
That isn't very good at all for anybody.
On the Gold Coast, Alex is dealing with an unusual cat burglar who seems to have developed a taste for his owner's jewellery.
So when you say
Tiffany jewellery.
Yes.
What sort of
So
jewellery?
she's saying a heart-shaped or a pendant about that big, so maybe about 10-cent coin, something like that.
Okay.
So
And how sure is she that he ate it?
pretty sure.
Simba's owner, Amina, immediately became alarmed when she noticed her expensive Tiffany locket was missing.
I didn't see him swallow it. He was biting me on my wrist, and then I took off the bracelet. I looked around my bed, looked on the floor, looked everywhere, and I was like, did you swallow it? And he looked like he was like ashamed or angry or something. He just ran off, and I'm like, oh my God.
Looking a little bit sheepish.
Expensive taste.
Can you stay with me, Simba? I've got to check you out and find out if you've had a bit of a taste for expensive jewellery. Hey? Cats are generally pretty smart with what they put in their mouths, so if Simba has eaten it, this is a pretty unusual situation. His heart rate's okay. I just want to have a feel of his tummy.
Amina acted quickly, but Alex is concerned the missing locket could already be deep in Simba's gut.
Cats and metal don't go well together. If Simba has swallowed a locket, it could poison him through metal toxicity. So if it's in his stomach, then we've got a chance of getting it out. But if it's gone through further, that'll be surgery. The question is, has Simba swallowed the pendant or not? And the quickest way for us to find that out is to take an x-ray.
Come on, big boy.
A lot of the time we take an x-ray and there's actually nothing in there and it's good news and they can go home. So fingers crossed that's what's going to happen with Simba.
Good boy, darling. Hang on. Hey? You're a bit worried, aren't you?
Good boy. Oh wow, there it is. It's big. That is not going to be easy to get out.
That's really big for a small cat.
Yeah, that's not good.
No,
It's not good for you, Simba.
Simba's been nabbed, and suddenly his pricey snack has landed him in a whole lot of trouble.
Oh, Simba, what have you done?
That's huge. Gosh, how did he swallow that?
On the Central Coast north of Sydney,
You think she's going to head all the way to the van?
Australian Reptile Park boss Tim is preparing to take Daenerys on a road trip to find out if she's fertile.
Some days she goes left, other days she goes right.
Just taking the lizard for a walk.
But the huge Komodo dragon has other ideas.
That's sun pose. The lady needs a bit of sun. We've got an appointment at the vet's, a set time. So it's a short sunbake today and off to the vet's we go.
Brendo, you got that backpack? Yeah, good stuff, mate.
Inside the bag are tools and equipment to get a Komodo dragon off your arm or leg if they latch on.
I'll grab her from the front.
Yeah, let's do it.
You grab it?
Yeah. Got her? Every time when Dan's holding Daenerys and that head goes up near his face, we're always cautious. Her teeth are long enough and sharp enough, she'd go straight through the arteries. Really bad.
Okay, ready?
Good. She's a little agitated, but she's in the back of the van and it's a quick trip to the vet's.
How's she going?
She's about 40 centimetres from your head.
No throat puffing or anything like that?
No, perfect, mate. Still tongue flicking.
When you're working with a lizard like Daenerys and you're looking for a few different signs, potentially if she's going to come towards you, maybe to try and bite. One of those signs might be bending the tail. They've got a really strong muscular tail that they might try and whip you with. But also too, they'll start to puff out their throat. They'll start to grunt. They almost become very, very vocal.
The team must get Daenerys inside before she gets too distressed.
Here she is.
There's our pretty girl. Open the door so you can go on in.
There's something about holding a Komodo dragon out in front. She lets me do that. If she didn't want me to, she would let me know.
What we're looking for is eggs. They'll still be attached to the ovaries. They're not fertilised, of course, she hasn't mated. And those eggs will be just above the pelvis, so in the lower belly. If we put Kraken in with Daenerys, when she's not ready or not receptive, they'll fight. Now, when Komodo dragons fight, it ends very badly. So we're talking real serious lacerations, lots of blood, and something we need to avoid.
In Melbourne, one of Danni's regular patients is arriving, 12-year-old Labrador Buddy with owner Hayley.
He loves his walks, he's very energetic, he's a very bouncy dog, and the last few months he hasn't been himself, that's for sure.
Buddy's been struggling to walk properly, and the family is becoming increasingly concerned about their elderly boy.
My girls are very upset about it, and they don't want to see him in pain and like this, so yeah, it has been hard. It has.
Hi, Hayley and Ava, how are you?
Good, how are you?
Good. Hey, buddy boy. Give me a say hi. Oh, hello, hello. How's he been?
A lot better since he's been on his medication, definitely.
Wonderful.
Yes.
Wonderful.
So Buddy's come in today because we saw him a week ago and he was quite lame and sore in that right hind limb. I have a feeling we've got some cruciate disease going on, but considering his breed, his age, and the fact there is some quite significant swelling and thickening around the knee, I am concerned there could be a tumour there. Oh, I'm glad he's feeling a bit more comfortable.
He is, for sure.
He's still looking a little bit tentative on that leg, a little bit sore still.
Definitely.
Yeah?
Yes.
Okay. We'll get some x-rays today under sedation and just see what's going on there, and hopefully we can get some answers and make a plan from there. All right?
Great. I'm very excited to find out, and we'll do what we need to do to get it fixed.
Okay, buddy boy. And you're mate. You want to come with me? You say bye to Mum. Bye, Mum. Bye, Ava. Oh, big cuddle. Oh, you're gorgeous. Okay. See you later. Bye-bye. Oh, you're going to take me for a walk. Okay. You want to come this way? You good boy. See you later, guys. All right, mate, let's have a listen to your heart. Hey, have a listen to that ticker. Good boy. All right. So having a feel along this leg, I'm just feeling for areas that are painful, any thickening. I have a feeling there's probably some cruciate disease going on, but I am concerned it could be cancer. There's definitely something going on there. There could be multiple things going on.
So let's put some cameras up.
Sounds good. Let's go.
In Bondi, Kate is using modern technology to try to work out what's making rescue dog Bruce so agitated.
Okay, we've got our last little camera, you guys.
Yep.
We're going to get Bruce outside.
Sounds good.
Come on, buddy.
Brucey. Let's go. That's good boy.
We're going to put this camera down and then we're going to exit. Okay, let's just put this little one down here. You can already see Bruce. He's very anxious. Not happy about us going.
Yeah, it's fun.
Oh my goodness. This is worse than I expected.
Yeah, it's pretty painful. It's hard to hear as an owner.
Oh, it's bad.
So we have to organise, Anna, it's your turn to go, or my turn to go, or whatever it might be, you know.
Or one of us can't leave. We have to wait for the other one to come back, so then we can take shifts to go.
Yeah. I actually think at this point the whole of Bondi can hear him.
Yeah.
Definitely.
The other neighbours are yelling at him, so
yeah.
It's become a neighbourhood issue, not just the house now.
I'm honestly surprised that he hasn't hurt himself.
Yeah, well, yeah, exactly. We're waiting for that.
And if he hasn't hurt himself by now, he's going to.
Yeah, what's the matter?
It's only a matter of time.
Yeah.
North of Sydney, the ultrasound on feisty Komodo dragon Daenerys is going well, so far.
Yeah, there's definitely some in there.
Tim's optimistic she's ready to mate, but first he's hoping Dr. Robin will confirm that she's fertile.
You can see.
Yep.
They're eggs.
Yep, okay.
She's got to come down. Whoa.
This is excellent news because really they're not very often bred in captivity, and if she's ready and Kraken's willing to do the deed, then hopefully we'll have success.
Wow. These little black circles are eggs?
Correct.
And is that real size?
That's real size.
They're that big?
2.9 to 3 centimeters. They're quite large. And you can imagine what size they are when they come out.
That's 1, 2, 3, 4, 5, 6, 7?
6, 7, maybe even 8.
So That is exactly what we're after.
That's what we want to see, because that means she's ready.
Yeah.
There are very few Komodo dragons born in captivity and only 6,000 left in the wild. So Tim is wasting no time teaming Daenerys with a mate and hoping for success.
It's critically important that we try and breed Daenerys. One of the leading causes of death in Komodo dragons in captivity is egg peritonitis. Now, that is when the eggs are inside, they're not fertilised, she didn't breed, but they sit there. They can rupture, they become infected and cause death.
Yeah, I'll take Kraken out onto the grass. We'll stay out there for a little bit.
He's at the door.
He's ready to go. I can hear him scratching. He's excited.
And here's the man of the moment. A hefty 70-kilo male called Kraken.
Now, while he's walking, we'll let Daenerys into Kraken's enclosure, at which point we'll bring Kraken back. You can see her. He spotted her. An introduction is very delicate. She's going to test him. She's going to want a male to follow after her. At that point, it can go really good or it can go really bad. That's what we want.
He sounds like he's being tortured.
Yeah.
It's pretty distressing.
Kate is witnessing firsthand how distressed Bruce becomes when he's left alone.
I've heard enough.
Okay.
Let's put him out of his misery and let's go back inside and have a look at this video footage. And then I'm going to give you guys some strategies on how we're going to manage this.
Oh, I'm nervous.
Hey, buddy. We're nervous about seeing the footage, but at the same time, we're hoping that this is the start of the solution. Yeah.
All right, let's have a look at these.
All right.
Here it comes. Oh, Bruce.
He looks so sad and distressed. I mean, I cannot imagine what he must be feeling as well. It's heartbreaking. It's hard to watch.
Oh, he's going back. Oh, he's doing it. He's just searching for a way out.
He's looking for all the points that we come from. He looks at our bedroom window. He goes to the back door. And you can really see he's just frantically looking for us. And it's just, we've been taken away from him.
Yeah.
And we can't go on like this. Bruce can't go on like this.
It's horrible.
I think we've all seen enough. We know what's going on and how bad this is. Bruce can't keep going like this.
Come and have a look at this.
Whoa.
Yeah.
On the Gold Coast, Alex just x-rayed Simba the cat, and she wants to show her partner Gerardo her extraordinary find.
I've got to say, I did not expect that. My biggest worry is how are we going to get this out?
Simba has swallowed his owner's expensive Tiffany locket, and Alex is concerned he could be poisoned if the metal pendant starts to corrode.
I'm seeing one huge challenge with getting that out. Look at this, all this food.
That's going to be an issue.
Simba urgently needs an endoscope, but the special camera will struggle to locate the locket with so much food all around it.
If that locket moves out of the stomach into the intestine, it's too late and Simba would need surgery. Okay, let's go and tell her the news.
Simba's worried owner Amina has been waiting for news about her cheeky cat burglar.
Hey Amina.
Well, when I heard that he swallowed the locket, I absolutely couldn't believe it, but it's something that he would do. I was scared, like, what if he dies? I don't know, I was just so anxious, I started crying. Like, if something happened to Simba, I don't know what I'd do with myself. I just care about, like, that he's okay.
Sorry, Simba. I know. Sting, sting. Good boy, I'm sorry.
The first thing we're going to try with Simba is to induce vomiting. There's a small chance the locket will come up, but I'm hoping we can remove at least some of that food.
The drug also makes them sleepy, so it is also possible that he might just fall asleep.
Now it's just a waiting game to see if Simba will vomit with this drug that we've given him. It only works in about 30% of cases, so there's a more than even chance that he's not going to vomit, but it's worth a try. Oh boy, you're okay.
As the minutes tick by, Simba isn't responding.
All right, we'll have to go to plan B. As I expected, no vomiting and a very sleepy Simba.
The plan now is to put the camera down into Simba's stomach to see if they can locate the locket.
Just going to induce anaesthetic now. So we need him asleep for this before we put the camera down into his stomach. This is going to be a two-man job. I'm going to position the scope and Gerardo's going to drive.
Okay.
He's got skills back from playing video game days, so I think he's got the best chance of getting this out because it is not going to be easy.
Okay, here we go.
I'm going down.
Fingers crossed we can grab that locket and pull it out. Bit of the esophagus. Heading down towards the stomach.
Oh, he's awake. Whoa, 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 whoa.
Suddenly, things take a turn for the worse.
Quick, 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 quick.
Oh, yeah, okay. All right, sorry, mate. So, he's quite sore in there today.
12-year-old Buddy is having trouble walking, and Danni needs to find out why.
Oh, sorry, Papa. I'm a bit concerned because we've got a lot of muscle wastage in both of these back legs. Potentially something going on in the left back leg as well. So we're going to get x-rays of that today, just to make sure we're not missing anything else. And that will affect our plan going forward as well. Hey, mate. All right, mate, just going to give you a little jab, okay? Very brave.
I know. Very good.
Oh, such a brave boy, hey? So I'm just giving Buddy a little bit of sedation because we do want to have a good feel of that right knee joint to see what's going on there. So the sedation should just take the edge off so that he's more comfortable. Hey, just a little clipper.
All right, mate.
Good boy. Hey, Buddy.
Gentle Buddy's been the perfect patient until now.
Buddy's become a little bit stressed and anxious, which isn't surprising. Certainly animals do get very nervous when we're trying to do things to them. They don't know we're trying to help. So I want to just back away, give him a little chance just to settle into that sedation, and we can rethink how we're going to approach this just to avoid any unnecessary stress today.
Some quiet time in a darkened room can often help distressed animals to relax.
I have a feeling we're not going to need any more sedation. Hey, mate?
It's certainly done the trick with Sleepy Buddy.
Just got this catheter in just in case we do need to give him any further sedation. Okay, just a little sting, mate. Okay, good boy. And also, obviously, if anything takes a turn for the worse and he needs his sedation reversed promptly, we can do that quickly. Hey? Okay, all set.
An X-ray will give Danni a clearer picture of what's going on with Buddy's troublesome legs.
Because Buddy does have a lot of muscle wastage in both of those back legs, it is really important that we get some x-rays of both the knees and the hips because there could be a few things going on that could explain why that's occurring. And certainly if there is something sinister like a tumour, we will be able to pick that up. All right, x-ray. Beautiful.
Danni's desperately hoping Buddy's lameness isn't due to anything sinister like cancer.
Here we go, mate. Okay. So I'm having a good feel of that knee joint and I can feel a lot of laxity there. X-ray. So that certainly says to me we've got some issue with the cruciate ligament. I'm gonna cover on your little pillow, hey? Oh, hi. Good morning. But if there is a tumour there or a cancer in the bone, it may mean that he has to have his leg amputated. You just relax for a bit, mate, hey? You just relax.
At the Australian Reptile Park, Tim's hoping love is in the air in the Komodo dragon enclosure.
They've sized each other up.
Female Daenerys is fertile, but is she ready for the advances of male Komodo kraken?
Now, the chase is on. She'll keep running until he can catch up and show her the male that he is. Kraken's showing a little bit of frustration. Daenerys' skin is very thick, but it's no match for Kraken's teeth. Oh, that's heating up a bit. Yeah, we don't want that.
Tim may have to intervene.
Kraken's starting to worry us. He's bitten Daenerys right across the face. That's not a good position. Kraken lets go. No harm done. We've got a little bit of blood on one of Daenerys' brows. Kraken's fumbling around a bit, trying to pull her into a position where he can go into a mount.
That is incredible.
And he's in mount position now.
That is perfect.
It's looking good.
He's gonna mate.
Oh, wow.
After many years of looking at these dragons from just this long to the size they are now, we've got our first mating.
The next few days, we just expect multiple copulations.
Could be our first ever clutch of Komodo dragons.
Oh, he's awake. Whoa, 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 whoa. Quick, 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 quick.
On the Gold Coast, cat burglar Simba has suddenly started to wake up from his anaesthetic.
Give me another needle.
Alex and Gerardo are trying to retrieve a silver locket from the 2-year-old cat's esophagus.
Heart rate doesn't even change.
After a few tense moments, Simba is fully under again, and the hunt can continue for the missing locket.
Looking good.
Unfortunately, Simba's full stomach is making the search difficult.
Like rice soup, and we got to go snorkeling through it. Yeah, this is not a good situation at the moment. We've just got zero visual on anything except for a whole heap of food in the stomach. It's making it really hard. We can't find this locket, and I'm worried it's moved out of the stomach and into the intestine.
The decision is made to quickly do another X-ray in the hope of pinpointing exactly where the locket's located.
So it's sitting on the right side.
So it's in a TV position.
At least it's still in the stomach. Simba's now been under anaesthetic for a long time, and the longer he's asleep, the more chance of complications. All right, back in.
Just hold him. Yeah, that's why.
Okay.
Whoa! Oh yes, you have. I got it.
Finally, the team's in luck.
Hold on to that thing.
Oh my God.
All right, you do not let it go.
Not let go, Amelia.
This is one of the most complicated endoscopes we've performed. It's taking every member of the team to do this.
Okay. It's in the esophagus. Yep.
Okay.
That's it. Oh my.
Oh yes.
Wow. It is a locket too. I still can't believe that a cat would swallow a metal object that large. That was an hour and a half, and in the end it paid off, and it's out. Cuddle you up, mister. Wake you up. We're just going to move Simba into ICU for recovery just because he's been under anaesthetic for a long time and some of the food's come up his esophagus, so we need to watch him really closely and protect his airway.
Today, mobile vets Audrey and Alison are making an unusual house call.
All right, let's just grab all the stuff we need and get in there. Yep.
They've had a call from Edie to check on her 4-year-old macaw, Skittles.
Hello. Hi, Edie.
Hi. So our first impression when we see Skittles is that she is absolutely massive.
Much bigger than we initially thought. Hey, Skittles. How are you going?
Handling the tricky patient is definitely going to be a 2-person job.
You got your wild eyes on today. You know what we're here for.
Macaws have dangerously sharp claws and powerful beaks capable of splitting open hard nuts, so the girls need to be extra careful.
Oh, no.
My little munchkin.
Skittles was given to Edie as a 60th birthday present, and the two have formed a special bond.
Yeah, got your confidence back?
It's almost like mother and daughter. She absolutely loves this bird, babies it, and you can see that connection.
What would you like to watch? People thought I was crazy by getting this bird, but she's just brought so much joy into my life. The typical day with Skittles would be when I come home from work, we watch TV together for hours.
I think we should try and make friends before we go for the nail trim.
Good idea.
While most girls love a manicure, Skittles is playing a bit hard to get.
So we've got to get Skittles off her cage. She seems a little bit weary of us.
Look, Skittles, what Auntie Alison got for you.
With having people around, I think she's a little bit hesitant. I think she's just cautious.
Yes. We've got to come up with a plan. Maybe Mum can give her a cuddle and we'll pop a towel over the bitey end.
Yeah. Come on, no, don't whine. She came from a very, very busy house where there was a lot of action, and I think she didn't really like it. Oh no, she doesn't like the towel. She knows what that means.
So we eventually managed to get Skittles down from the cage. Mum's got her wrapped up in a towel just like a little baby. Alison's distracting the bitey end and I'm going in for the claws.
It's all right, my little girl.
It's good.
All right, you're a good girl. Look, oh, if you're a good girl, we might even paint them.
And just be careful of her quick at the back.
You're being very good. You're being very
she's
good.
a good girl. Oh.
I know, Mummy's right there. So you do have to be a little bit careful because she's got the black nails. So there is a quick that lies underneath. So if you trim that, it can bleed.
Yeah.
So I'm just taking the very tips off. Done. There you go.
Oh, good girl.
Hi, Chicky.
Audrey has finished the claw trim without losing any fingers. And now Audrey is going to do a quick health check.
You want to have a look at Auntie Ellie while I feel your chest? That's a good girl.
Her little heart's beating.
It's beating very fast. That sounds good. So what you want to feel here is her keel. So that should be a lot more prominent. And there is quite a lot of kind of fleshy mass beside it. And it's quite hard to feel her keel bone. So I would say she's a little bit on the overweight side.
Skittles can be quite a guts. I don't think she passes the chance to eat anything. That's her favourite treat.
So Edie's got a bit of work to do to try and get Skittles' weight down.
Maybe it's a combination of too much nuts and too much television.
Other from the little bit of extra weight that she's carrying, she's pretty good. Her heart sounds fine. I'm quite happy with her general health.
Well, I think we know who you love more, eh? The one who doesn't clip your nails or listen to your heart, eh? Hey, beautiful.
I'm sorry. It's okay. You just relax for a bit, mate, hey?
In Melbourne, Danni's been trying to find out why elderly Buddy is having trouble walking.
Right, let's have a look at these x-rays. Fingers crossed for the best case scenario for little Buddy. All right.
She's hoping Buddy doesn't have something sinister.
So we've got his right knee here, so this is the problem one. And I am not seeing any changes in that bone to suggest there's any cancer there, so that's really good. Yes! I am seeing some swelling in the joint, so that makes sense with what I was feeling as well. And there are lots of little bony changes around the joint that suggest arthritis that makes sense as well. So considering that soft tissue swelling and what I'm feeling when I manipulate that knee, I'm pretty confident that we have fully ruptured the cruciate ligament, but it is a good scenario, believe it or not, I guess, for him. So this is actually the best case scenario for Buddy. Does mean he's going to have surgery to sort out that cruciate, but he is cancer free, and best news is he gets to keep his leg. What a relief.
I know. He's such a
good on you, Buddy boy.
Danni's excited to break the news to worried owner Hayley.
It's been a big day for Buddy today, but he's done very well. He's a little superstar. So we've got all the x-rays and everything that we needed. I did have a good feel of his knee under sedation as well. And the good news is there is no cancer. There's no tumour And I was a little bit concerned, considering his age and being a Labrador, that there could have been something there. He does, however, need to have some surgery. He has ruptured the cranial cruciate ligament. Okay. So is that something that you're able to go ahead with for Buddy?
Yeah, well, we have spoken about it as a family, and yeah, we're definitely going to get surgery done.
Oh, wonderful. There's a great prognosis with it. They do respond really well, so I think you'll be a much happier boy with that.
He's a big part of our family, so we want to see him happy.
I bet he is. He's such a little character.
He is a good dog.
He's a puppy in an old man's body. Good. Yay. So yes, good result in the end.
Perfect.
Yeah. Great. Wonderful. Well, how about I go get Buddy then? Wonderful. Okay, bear with me. I'll grab him now. Hey, Buddy, this is your family. Hi. Oh, now, I've given him an arthritis injection, so that should help make him feel a little bit better. And we've got those anti-inflammatories that we'll continue with in the meantime, okay? That's beautiful.
Good. Thank you so much.
Alrighty, guys. Well, all the best. We'll see you very soon.
Yes,
okay?
we will. Thank you again.
See you later. Bye, Buddy. Bye.
Hello Bruce, how are you? These are for you, but we'll talk about them with your mum and dad in a minute, okay? Just a minute.
In Bondi, Kate's back to visit rescue dog Bruce, armed with some tips and tricks to help him overcome his severe anxiety.
Good boy.
When you think about how Bruce must be feeling, he is suffering. He has got massive, massive anxiety. He would be like spending his whole life worrying that someone is going to leave him. This is a quality of life issue for Bruce, and we need to solve this for him. The most important thing to remember, work on your basic training. Bruce has never been to puppy school. He has no idea how to sit, stay, wait, any of these really basic things that dogs of Bruce's age need to know. So we need to start there. So dogs learn hand signals faster than they will words.
Yeah.
Use a hand command when you use a word. Okay, ready? Wait. So good, Bruce. So good. The second part of this is, as soon as you walk through the door and he jumps all over you, no attention until such times as you feel like he's quite calm.
Okay.
The other important part of this is no attention 30 minutes before you leave. That's the time that you need to start ignoring.
Right, okay.
So this is a snuffle mat. They look bizarre, but they're very helpful. And what you do is you hide treats all in here, right? And he has to snuffle around and try and find all of the treats.
Good boy.
Okay.
Really what we want to do is keep him occupied for that 30 minutes after you leave, right? Because that's the window that he's so anxious. Bye, Bruce. That's going to take a little while to get to a point that they can actually leave the house, but it may mean they can actually go to the toilet on their own. This was a total success. Bruce loves food and he loves that snuffle mat. And every time we do this, we just increase the amount of time that we leave for just that little bit longer. And over time, Bruce will realise that people will come back. So good. That was a really good first start, you guys. Well done.
Yeah, very good. He likes that.
So good. You might even actually be able to get him to do this on the outside by tomorrow.
Nice.
This is not a short-term fix. This is going to be something that we have to manage for a long time, and it's going to take a while to get us on track. There's also a genetic component.
Okay.
And the only way we're going to be able to have a chance at changing that is by using medication.
Yeah, right.
Just because he's on medication doesn't mean he's going to stay on medication for his whole life. When we see an improvement and we think we're getting there, we can start potentially thinking about weaning him off.
Okay.
And we know that it's not going to be easy and it's going to be challenging, but we're both prepared to make sure that, you know, we stick to a good plan that's going to make him really happy ultimately.
Okay, remember, not a fuss when you leave like I just did.
Yes.
I'll see you later, alligator.
Good boy.
Hey, little man. Looking a bit sleepy.
At the Gold Coast Emergency Hospital, Simba the cat burglar has fully woken up.
Hey, you gave everyone a fright. Hey, but you're looking good. You woke up okay.
So Simba's looking really good. He's recovered fine from the anaesthetic, and I reckon we'll be sending him home tonight.
Alex is excited to reunite Simba with owner Amina.
Look who I've got here. Very happy boy to see you. Oh, I'm sorry. Are you okay? I've got something for you.
Amina's also getting back her missing locket.
It's actually from an ex-boyfriend. I actually asked him, like, do you want me to give it back to you? And he said no, and I kept it because it's beautiful. Like, it's Tiffany. Like,
Yeah.
you can throw away Tiffany.
Oh, yeah, the source of so much trouble.
Pretty much.
I'm sure he's going to get lots of cuddles tonight.
Yes.
See you, Simba. That's the first time I've ever taken a heart out of a cat, and I'd say that was pretty successful. Will you stay out of trouble, Mr. Hay?
I can sleep soundly now.
That is incredible.
He's in mount position now.
That is perfect.
The love match between Komodo dragons Daenerys and Kraken didn't go quite as well as expected, with no baby dragon to report. But Tim is hoping for better luck next time round. As for elderly Buddy, his cruciate repair surgery went well and he's made a full recovery. And cat burglar Simba has also fully recovered after the ordeal to remove a Tiffany locket from his esophagus.
When Simba first came home, he wasn't eating much because his throat was hurting. But after a few days from the hospital, he was such a naughty boy, like up to no good. Like he walks around on shelves, he knocks things over. He just gets so excited. And every single time we eat dinner, he's always at the couch waiting.
Expensive jewellery is now definitely off Simba's menu.
Good boy.